drinking and smoking for your children. Mr. Young and Mrs. Young wanted to conceive a healthy baby. It was their first child, so Mrs. Young wanted to consult with an expert.
Let's go to the OBGYN so we can plan out a diet for a healthy baby,
said Miss Young. Okay, let's go. It will make you feel more reassuring, said Mr. Young. At the hospital, they met with Dr. Katie, who specializes in babies. Dr. Katie told them to eat as much fruits and vegetables as they can, but not as much of certain fishes that have high amount of mercury that could harm the baby. Mrs. Young, upon hearing that stuff that can harm her future child, started asking about the side effects of drinking and smoking.
I have been drinking and my husband smokes. Are there dangerous side effects on pregnant women who drink and receive secondhand smoke?
Asked Miss Young. Dr. Katie was pleased at how serious Mrs. Young cared for her child to be. Dr. Katie started to talk about the importance of parents not drinking and smoking during pregnancy.
Drinking and smoking are not healthy habits for your future child. According to the Center for Disease Control and Prevention, tobacco use in pregnancy, women who smoke are more likely to miscarry, have higher likelihood of placenta problems such as early separation, which can cause bleeding. They may have premature births or low birth weight babies, and smoking during and after pregnancy may lead to sudden infant death syndrome. If you still don't believe me, there is another article called Effects of Prenatal Alcohol Exposure on Child Development. Your child might have hyperactivity and attention problems, learning and memory problems, social and emotional problems, low birth weight and fetal alcohol syndrome. Fetal alcohol syndrome is when your child is born with a small head, small eyelid openings, flat midface, thin upper lip, flat or smooth groove between nose and upper lip, cognitive/behavioral problems, and growth retardation.
The couple thanked the doctor for gaining the knowledge of drinking and smoking during pregnancy. During their ride home, Mr. Young let out a big laugh.
Dear, don't let that Dr. Katie scare you too much. Our baby will be fine. Look at me and you. We both work out 5 days a week and we're both looking good. Our body figure and brain will be passed on to our children without any problems,
said Mr. Young.
But Dr. Kate warned us of the side effects,
said Miss Young.
Honey, we're the most healthy people around here, so our child most likely will have high resistance to alcohol and cigarettes,
said Mr. Young. That night they went to a friend's party. There they met Mr. Brown, one of Mrs. Young's friends that had a child.
How is your child, Mr. Brown?
Asked Miss Young. Mr. Brown was very sad.
My child is already 2 years old, but he looks like he was just born 2 months ago. Still have not said his first word, and he doesn't sleep that much since the beginning. Miss Brown and I have been in and out of the hospital these past 2 years for our son. This could have all been preventive only I followed a journal called The Effects of Smoking and Alcohol Addiction During Pregnancy by the American Society of Registered Nurse. Pregnant women who drink 10 to 15 units of alcohol a week have been found to have underweight babies. Consuming alcohol during pregnancy also affects the fetus development, affecting the baby at birth, increasing disease susceptibility and cognitive abilities,
said Mr. Brown.
I am sorry, Mr. Brown. I hope your son gets better,
said Miss Young. After comforting Mr. Brown, Mr. Young went to get a drink for him and his wife.
Did you not just hear what Mr. Brown just said?
Said Miss Young.
Like father, like son. Mr. Brown wasn't so big when he was a little boy, and he was also sick most of the time during school days. You don't have to worry about our child turning out to be like that when we are parents,
said Mr. Young. The following day, Mr. Young was watching the news.
Good day, folks. This is Channel News 101, an article called Smoking During Pregnancy by California Department of Health Services Tobacco Control Section stated, if all pregnant women in the United States were to quit smoking, there would be an estimate of 11% reduction in miscarriages, a 5% reduction in newborn deaths. Let's all cross our finger and hope it all happens, folks. We shouldn't forget about our secondhand smoking husbands, too. An article called Pregnant Women Secondhand Smoke Can Harm Your Unborn Baby said that researchers have found exposures to secondhand smoke increased the non-smoking pregnant women's chances of having a stillborn by 23%, and increase the risk of delivering a baby with birth defects by 13%.
That night, Mr. Young dreamed about his future child. In the dream, Mr. and Mrs. Young was in the hospital and their child was born premature and was diagnosed with fetal alcohol syndrome. Miss Young was crying.
Boo-hoo-hoo. Why didn't we listen to Dr. Kate? Boo-hoo-hoo.
Cried Miss Young. Mr. Young woke up from his nightmare and let out the scream.
No!
Yelled Mr. Young.
What happened, dear?
Asked Miss Young.
I had a nightmare about our child if we didn't stop drinking and smoking. It was horrible. We gotta stop drinking and smoking for our children's future.
Said Mr. Young. Mr. Young learned his lesson and now they can start making the babies.
How low can you go? 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 How low